What are the principles of movements for better posture is the question you asked. In order to understand what principles of movements are, you have to understand that better posture is a dynamic thing and it is not a static thing. When you are wanting to have better posture, there are certain principles that need to be in place. However, you got to understand that posture is an authentic thing that happens as a result of following these principles that I'm about to show you over a course of time. Where do these principles come from? Well, from me, but it's from many years of doing what I do. And so I have basically come up with a list of things that will kind of have to be in place in order for you to have a better posture. So I'm going to tell you what those are, and then I'm going to tell you a little bit more as to why it's important to even have a good posture. Hopefully you're not looking this video up because you want to have better posture for aesthetic, because posture is a reflection of a lot of amazing, great things that are in place. In order for you to have a better posture, the first thing that has to happen is you need to breathe biologically. Biological breathing is what we understand by studying human babies. I've done videos on that. If you have not subscribed to my channel, make sure you do and you turn on that notification bell. So next time I put a video up, you get to be notified. Biological breathing is what provides you with the breathing apparatus and what it takes for that certain parts of your body, the transitional segments and the transitional areas in your body to line up. This is kind of like playing pool table. When you're playing pool, you hit that white ball in the right direction with the right amount of force, and next thing you know, it makes it to the hole. So you want to give yourself what it takes to increase your batting average. The next thing that you want to do, I'm going to step away, is you want to place your hands on the sides of your hips. Your hips are not your waist. Your hips are lower here. They're not back here. They're right here where the legs get connected to your pelvis. So place your hands over the ball, and you want to make sure that the ball lines up with the outside bump of your ankles. Most often, people's pelvis are in front of their ankles, the bump, or behind it. So you want to be stacked on top of it. You don't really need to look down because your brain has a map of your body parts right here. So practice really seeing things in your head because you can. So then the next thing you want to do is you want to have a neutral spine. Neutral spine means your pelvis is neutral, means you're not tilting down or you're not tucking under. So it's neutral. Neutral does not mean you take away the curvature here because that curvature is there to stay. But you are, by you breathing biologically, you're pushing the front of your spine is being pushed back, and the spine is being sandwiched between the pressure from your breathing and the muscles on the back. So it's nice and stable because the stability of the spine connection to the pelvis is highly, highly important for a lot of things, including great posture. So you're breathing biologically, you're having a neutral spine, and because you're breathing biologically, you have a circumferential expansion of your barrel, of your trunk, which is highly, highly important. You want to make sure that you glide your neck back. So gliding your neck back does not mean you tuck your chin and shove it back. That means your chin is parallel to the ground, maybe slightly lowered, and the back of your neck muscles will pull the neck back towards the back wall. Now we're going to concentrate on the shoulder blades. Your shoulder blades should lay flat on your back. When they're lifted up, when you have angel wings, as they call that, that's an indication of a muscular, the dysfunctioning patterns of movement. There is an actual name for it called scapular dyskinesis. All that means is the muscles that stabilize your pelvis are not doing a good job. So ideally, we want to have them flat on our back. Now remember, Your shoulder blade is not your rib cage, and it is not your mid back. So you're not manipulating your chest to try to get them there. That's a very subtle movement that has to take place. Another tip that I tell my patients to be aware of is to place the tip of their tongue right behind the front teeth and the middle of the tongue to the roof of the mouth. That gives a better cueing for the brain to know where midline is, because a lot of times your body has had to change its position to modify its presence based on what you throw at it. So we're trying to statically, even though posture is not a static but a dynamic thing, to bring awareness into our movement and presence of things, and over a course of time and make that happen more and more. So it's ball over bump, neck over crotch, shoulder blades are flat, glided neck. You're obviously breathing biologically, and you are placing your tongue in the place that I told you about. I do this every time I go to the bathroom and washing my hands, or at my kitchen and washing my hands. So it's just an awareness there. It's not sustainable if you think this is all you have to do. It becomes you when your body parts move based on the blueprint of movement. If you're wondering what that movement is, we have studied human babies. We know every baby on this planet moves exactly the same way. There are developmental stages and patterns of movements that need to be in place before the next movement happens. So when it comes to rehabilitating individuals with poor posture or chronic joint issues or instability in the joints, I follow the same exact patterns, and I can tell you very comfortably that it never fails. It never fails, not because I'm outstanding. It never fails because that's the pattern of movement. I'm just following the manual of movement. It is highly important for you as the owner of this body to take the responsibility in understanding what right looks like, what your natural tendencies are, and how and what to replace your wrong with the right. And understand this is not just for now, this is for the rest of your life. It's kind of like driving a car. You understand the principles of movement, of driving. You understand and exhibit how to drive a car. And let's be honest, after how many years of driving is it okay to pass a red light? Never. So these are the things that we have to accept as facts of life and take the responsibility to make sure we bring them into our profile of movement. And next thing you know, your posture is better, your movement is functional, and you have a lot more energy than ever before, because this poor body does not have to go against the ocean of wrong to get you from point A to B. I hope this made sense. If you have any questions or comments, make sure you put it down below. I answer them myself, and if need be, I'll do more videos on that. Until next time, take care.